This conference will now be recorded. This conference will now be recorded.
Okay. All right. Well, I guess we're recording.
Okay, Casey, are you ready?
Yeah, Katie, I'll go ahead and go live and go for it.
Okay.
All right, we're good.
Okay, welcome everybody. Today is Monday, September 21st, 2020, and this is the meeting of the Lincoln County Board of Commissioners. I have both Commissioner Hall and Commissioner Hunt and myself here remotely. So we have all three commissioners here, which does constitute a quorum. I will say that we received some comment that the way our agendas are being done that say special date and time have been a little confusing. Our meetings pre-COVID were on Wednesdays. We started meeting on Mondays because a lot would happen over the weekends and we didn't want to wait. So we started calling them special meetings, but at this point, they're just our meetings. So we will stop calling them special meetings, and as of next week, they will just be kind of our regular BOC meetings. So thanks for calling that out to our attention. We have a really full agenda today, and there is some agenda changes I'm going to make just to kind of help us roll along. So we're actually going to move something down to the very bottom of our agenda. Keep going. There we go. Under decision and action item, we had K9 Bonnie's retirement. However, I was told that K9 Bonnie has a short attention span and does not do well sitting for large periods of time. So we asked if they wanted to come at the very beginning of the meeting and have that dealt with first, and I think that's what's going to happen. So with that, I will go ahead and turn it over to Sheriff Landers and Deputy Atkin.
Good afternoon, Commissioners. I am Curtis Landers, Lincoln County Sheriff. Thank you for moving that up on the agenda. I think it helps with not only the attention span of Bonnie, but also Deputy Aiken's time, as he's got probably other things going on. And I saw the lengthy agenda, so I appreciate you moving forward with that. So it is really mixed emotions that we're announcing that Bonnie is retiring from duty. She's had some basically the trainers and have said that she's basically at the end, given her situation as far as health and what she needs to do to fulfill the duties. And but doesn't mean that she's no longer going to be with us. She's actually, if you approve this, and it's really kind of interesting how we have to do this. You know, Bonnie, as far as I'm concerned, is a part of our sheriff's office, and she's a member just like anyone else. Although she is a K9 member, and so basically doing that, Bonnie is one of our tools that we use. And in order to do what we need to do, we need to declare her as surplus. And so in order to do that, once that's done, then Bonnie will be able to reside the rest of her life with Deputy Aiken and with his home, but we're not able to do that until that is done. And just some background on Bonnie. Bonnie started her first day of duty was in September of 2015. She's logged several hours, working 40-hour weeks with her handlers to respond to emergency callouts, apprehending dangerous felons, and increasing the safety of law enforcement officers and the citizens. I'm going to turn it over to Deputy Aiken in a minute just to kind of talk about a little bit more about that. I'm sure he can explain it more than I can, but Bonnie was our first K9 to come back for the Sheriff's Office since the 80s. When I first started there, we actually had a couple of K9s, but that program went away, and we were able to bring it back in 2015, and we are very fortunate to do that. We have Bonnie Ann Nix is our other K9 that we have. And I believe what we're going to be looking for a K9 to replace Bonnie that Deputy Aiken will train, and we'll have a new one back out there. It's nice to have the two of them so that we can work all the days of the week. So I'll turn it over to Deputy Aiken and Bonnie if they have any final words, and then answer questions for you as we move through this process.
Thank you, Sheriff. Hello, I'm Deputy Aiken. I work on patrol. A little history on Bonnie. So she started with us in, well, she was first certified in November of 2015. Prior to that, Bonnie was born and originally trained in the Czech Republic. She was brought over to the United States by Adlerhorse out of California. They're a big vendor in the United States for law enforcement and canines. So in November of 2015, she was first certified with Jeremy Gottney as a canine team with the Lincoln County Sheriff's Office. Since then, she's had a couple of handlers. I am her third handler. Throughout her career, she's had a total of 16 criminal apprehensions. She's been involved in over 100 criminal investigations, and she's been utilized quite frequently over the years. And just over the last year and a half that I've had the pleasure of working with Bonnie, it is amazing to see what she can do and how intelligent she is. Since we started working together as a team, she's taught me, different aspects of patrol. I thought I had everything, sort of kind of getting started to get figured out as a young cop. And then the introduction of Bonnie into my daily regimen has greatly expanded my horizons. And it is sad to see her retire. However, I am happy for her that she did make it to retirement and she is in good health. We don't have any concerns health-wise with Bonnie, as she's getting to be a little older for patrol canine, and I would rather see her retire in good health than to get hurt on the job and not be able to enjoy her last few years. So the plan is hopefully when she retires, she'll stay at my house. We have a big yard that she gets to run and play in, and when I come home from work, we have to go for runs and go for walks on the beach and enjoy the rest of the days. So I'm happy to answer any questions.
So I can just add one more thing too. As Bonnie goes into retirement, staying with Deputy Aiken, Bonnie wasn't a PERS member, as the rest of the Sheriff's Office is. So we are, just since this might get out to a lot of the public, we are accepting donations through the Lincoln County Sheriff's Foundation to help with Bonnie's retirement, help Deputy Aiken offset some of the costs to do that. So we are doing that through our foundation and through donations, if anybody is interested in giving to.
Thank you, Deputy Aiken and Sheriff Landers, for that. And thank you to Bonnie for all of her years of service to us and all of her job. I don't have any questions at this time, other than just a big thank you to her and Deputy Aiken, and hope that she has a good retirement, doing what dogs do. So any questions from other commissioners? Oh.
Nope. I think we're
Perfect
hearing
timing
from Bonnie now. So I will echo Commissioner Jacobson's sentiments, and I can understand, it feels like a very bittersweet moment, but certainly, because she has been an integral part of the team these past several years, but certainly she more than deserves a happy and comfortable retirement. So I am happy to support the motion that will be before us to transfer ownership.
Commissioner Hunt?
I think the list of Bonnie's accomplishments that Director Aiken identified is clear evidence of the value of the canine program, and certainly one that I'm glad to see was reinstated in 2015, and one that I certainly support going forward. And again, it was good news to hear that while we certainly can't replace Bonnie, there will be a new canine member in the Sheriff's Office. The last comment I'd like to make is I'm sure, as has been noted, that Bonnie is a very intelligent dog, but I'm glad she can't understand English, because I think we would hurt her feelings if she knew she was being declared surplus. And with that, I'd be happy to move to approve the order declaring certain county property, certainly county-owned property, as surplus.
I'll second that motion.
All in favor say aye.
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 Aye. All right, motion carries and Bonnie can retire.
Thank you, commissioners.
Thanks.
Thank you.
All right. And Deputy Aiken, feel free to take Bonnie and get off now if you need to.
Thank you.
All right, thanks. All right, now back to our regularly scheduled program. We have the adoption of the consent calendar. These are items of a routine nature that either commissioners or staff can pull for further discussion or information if needed. And if that's not needed, then I will entertain a motion.
Move to approve the consent calendar as presented.
I'll second it.
All right, we have a motion and a second. All in favor say aye. Aye.
Aye.
All right, motion carries. And one thing I was going to say earlier and forgot is at the very top of our agenda, if Christy can scroll, we do have a new, we do have a new way to take public comment. We asked that it be done up to no more than 2 hours before the meeting, just so we have an opportunity to see it. But that is a smart sheet, so you can click on that and it takes you right to a online form. Ooh, thank you. So there you have it. So that's how we're doing constituent input. A little bit easier than the emails we had been doing before. So just wanted to make sure everybody was aware of that. Yep, so if you go on to our website, find the agenda, you can click right there and fill out constituent input. So just wanted to bring attention to that. And obviously there's a little bit of a transition time. So if we still get a comment through our BOC email, you know, that's fine. We're going to be lenient, but we do have an easier way to do that now. So, and thank you, Christy, for working on that. All right, let's take us down the agenda here. All right, we have a agenda packed with reports. At 3:30, we are having the OHA director, Pat Allen, join us to talk about COVID-19 and our phase 2 application. So we might end up doing some hopping back and forth today on our agenda, and I apologize for that, but trying to get everyone's schedules coordinated were a little challenging. But we will go ahead and start out with a Echo Mountain complex fire update. I believe either Wayne or Sheriff Landers was kicking us off, and then we were going to jump to Roy Kenyon and Anno Husing.
Commissioners, I think that Sheriff Landers is going to give you an update on the fire itself, and then the speakers who are coming after this can tell you some of the things we're doing in the recovery process and give you an update of that. So I'm going to turn it over to Sheriff Landers to start with. Okay,
thank you.
Good afternoon again, Commissioners. Yeah, we're making a lot of progress. Well, the firefighters are making a lot of progress with putting out the fire, getting that contained. We're able to allow residents back into the affected areas. I mentioned it this morning on our cooperatives call, but it is, from what I'm hearing from the deputies, very emotional as those citizens are going back into the area, as you can imagine. There's a lot of devastation. They're seeing it for the first time. I can't imagine if that was my residence and the feeling I would have for it. And even with that, still a lot of thanks and support for what firefighters, public safety, other officials have done for them. It's incredible to see, incredible and heartwarming to see that experience. But as far as Sheriff's Office, we are keeping the 24/7 coverage in the area so that we can protect houses, since there's not going to be a lot of people up there, and just round the clock coverage to address any suspicious people, any calls that come in that area, and just make sure that we're not getting any looting. I know that's been a question that's come up. We haven't experienced that at all. As far as I know, there hasn't even been any criminal activity in the area. So knock on wood, that's been good. In discussion with other sheriffs around the state and their local fire areas, that's not the case. They're experiencing a lot of looting in some areas. Lane County in particular is asking for a lot of help to go up and assist with that. So we're very fortunate to not have had that. Also very fortunate that during the assessments, no one was found deceased, and we are very thankful for that. During the uncertain times and the chaotic events that transpired during the evacuations period, it was, I don't know how it happened, but we are very fortunate and lucky, and I think just good job to the emergency management crew from getting the notifications out with Everbridge and Lincoln Alerts. from fire and law enforcement doing the evacuation, from everybody basically going in, all hands on deck to see and ensure that people get out. I think it's also neighbor helping neighbors. If somebody didn't know if a neighbor got out, they were double checking and making sure. So a combination of everything above. Good job for the community to making sure that happened. So. And as of 3 today, all road closures related to the fire zones have been lifted, and all areas have removed from the evacuation sites. So that's as of 3 o'clock today that's been taking place. So again, we are going to have more people, or same amount of people in there, but round the clock coverage to make sure with the openings of all the roads that we're not going to get any criminal activity in there. Any questions on that?
Not a question, but just a comment. Having known you for the past year and a half or so, I have come to know that you're pretty humble. And I think, as you just said, how did we get everyone out, and how did it happen having a zero mortality rate? Well, I think in large degree it happened because of the Lincoln County Sheriff's Office, and I don't feel like you give yourself and your team enough credit for that. So I just want to call it out and say, yes, other local law enforcement agencies were involved. Lincoln County Search and Rescue Team was involved, other fire personnel were involved, but the sheriff's deputies, including yourself even, I know, went door to door and helped evacuate people, did a phenomenal job, and that's the reason why. That is a large reason why that we had the 0% fatalities that we had, is because of you guys. So being humble as you are, I just want to call you out and say that you have an amazing team. They worked really hard with a lot of constraints, communication constraints, but you guys got it done along with other local partners. And I agree that it was neighbors helping neighbors and all of that as well, but just a big thank you to all of you and your team for doing what you did, because I think a large part of what we saw was because of all of you. So thank you.
I appreciate it, Commissioner. Thank you.
Commissioner Hall, questions or comments?
No, I would just really especially like to second your remarks, Chair Jacobson.
Commissioner Hunt, anything?
Well, I've said in other meetings that I think Webster's dictionary is going to need to find some new words, and this is probably one of those situations. Thank you. Clearly doesn't really express the appreciation for all of the hard work and the good work that the sheriff's office, the sheriff, and others did. And but I will say thank you, heartfelt thank you.
Thank you.
Thank you. All right, next up on our kind of wildfire update. I was up there, I don't know, the weeks blur together. I think it was last week. Completely heartbreaking to see. One of the things that became really obvious, though, is that there's a large amount of cleanup to be done. So I've invited Roy Kenyon, our Public Works Director, and our Solid Waste Manager, Paul, to be here today to kind of talk about those next steps and getting rid of the solid and hazardous waste that's left over from that. So I will turn it over to Director Kenyon and Paul.
Thank you, Commissioner Jacobson. This is Roy Kenyon, Lincoln County Public Works Director. And really the cleanup is kind of divided into two areas. We have the cleanup for the county road system, which, basically during the storm and after the storm, we did most of our emergency opening. We still do have a lot of debris out along the roadway. We were kind of waiting on cleanup until other agencies kind of got through their stuff. Ours will be probably going on for the next month or so. The biggest cleanup is, of course, going to be the solid waste issue, the debris. And as you said, Paul Seitz, our solid waste manager, and Steve Hodge, the county engineer, have been meeting with a lot of folks on the cleanup. And it's not just the cleanup itself, it's actually the safety part of it. It's trying to put together a planning process that allows it to happen correctly, that does not put people in danger, that gets it done as quickly as possible, but also does it correctly so that those who are eligible have an opportunity to put in for reimbursement funds. And so, like I said, there's been a lot of discussion, and I'm going to turn that part of it over to Paul Seitz. Paul, like I said, has been involved in this from day one, and he's far better to speak on these things than I am. So go ahead, Paul.
Well, thank you. This is related to the private property, by the way. Paul Seitz from Solid Waste Management District. This is all related to the private property issues and having mostly the problem of asbestos on their property, and making sure that when people get on their site, that ash, which contains heavy metals and other things, is something that they know what they're getting into, and that there's proper processes and opportunities for them to do it. What we're really teeing up is information for tomorrow, meeting with FEMA and your multi-agency resource center to provide good information to folks and have prepared information in hand, so when they walk away, they know what they're getting into, they know processes that will follow the guidelines from state to federal, and they have a good opportunity to make a successful cleanup. Granted, we may have federal cleanup come along, but many folks, as we know, are going to get on their site and start sifting through ahead of time. We're trying to get information to them as soon as possible. One additional part of this, I want to throw a thank you to ANO and their group. What we're trying to do is make sure that when people are on their site, that they're working, the contractor or the homeowner, in good faith, that doesn't disrupt our existing system, such as their septic, their subsurface, the utilities that come in. We want to make sure that the contractors and people that are working on it aren't single focused, but multi-focused on what they're doing, and they make a good job of these sites. And one last shout out, I really want to compliment North Lincoln Sanitary. They really stepped up. The homeowners at this point who have service as a regular part of their process are returning to that normal service. There are some folks who have disrupted service that we're working through individually, but for the most part, we are returning to a normal, and the system as a whole is trying to take this in as part of our local system, rather than just relying on mega systems to come in and clean it up for us. Glad to take any questions.
Thank you, Paul. I do have a couple of questions. One is, I think just from my own personal experience in seeing it, I don't think I really understood both the devastation to the county, but also how difficult cleanup might be until I saw it. I know there's many people, we've had calls from contractors and local people that are ready to, just kind of take shovels and start scooping it out. And I guess I'd like to just hear, what are the potential safety risks and complications from that kind of an approach? I mean, why is waiting for this planning process and making sure this is being done properly? Why is that important?
Very good point. So without getting into too many details, if your house was built between 2000 or after 2004, we have fewer concerns, and contractors can use normal processes to get on site for the most part. Most of these homes are pre-2004 construction, and that's where DEQ specifies that basically all of that ash that's on site is most likely going to contain asbestos, and there has to be special handling of the asbestos. So when the building burned, not only is there asbestos, but there's also heavy metals in that material. So a contractor or other people wanting to get on site of a homestead that is pre-2004 need to be aware that there are regulations, DEQ regulations, but also personal safety hazards, that even a person sifting through the material is exposing themselves to hazardous materials at that site. And wetting it down is one thing, but hauling and disturbing it is a whole nother thing. And they really do need to use certified contractors for removing that material. Is the best advice we can. And the reason why we've been holding off is to find the best process. And we now have a list of the local people or the people who are willing to work locally from the state list. And we have that now available. And we wanted to make sure all the DEQ rules were still in place and weren't going to be changes. So those pieces of it will be teed up in the next few days.
Okay, thank you for that. I think it's important for people to understand that those rules are not meant to get in the way of people rebuilding, but more so in making sure that we're not putting people at risk later on by being exposed to those things. So thanks for explaining that. Commissioner Hall, questions or comments?
Couple of questions. Well, you know, one comment and one question, actually, I guess. I have seen a few people say they've observed people on their property sifting through their remains, no gloves, no mask even, and you know, at least trying through their social media to say, no neighbor, please don't do that. It is potentially very dangerous. And then something I think may be implicit, but just to clarify it, if somebody does have a site where there was a pre-2004 home destroyed, is it their obligation or responsibility to hire a private contractor to handle that? There won't be any outside help for that?
When you say no outside help, we're not sure with the FEMA or other responses. Those may be coming in several weeks to months. Have that opportunity for people if they could just be patient with that. But in the meantime, you're absolutely correct. Disturbing the materials not only a threat to themselves, but also to neighbors, as those materials don't tend to stay on site, including fish and environment as well. The best recommendation we have is if a person does want to get started right away is to hire a qualified contractor. That's the safest. DEQ may allow self-haul, but it is an arduous thing with many forms and many boxes to tick, and we are tracking those materials. So it's something that the homeowner most likely is in over their head if they're doing it themselves. The honest answer.
Okay, thank you.
I just want to mention real quickly too, as we let people back into the area for the first time, we had a packet created with indicating a lot of the hazards that were there and present, and Council Belmont helped with some legal language in there as far as you know, basically you're taking risk into your own hands moving forward. And there were also a packet contained resources and other identifying things to help the individual out with too. So tried to inform them ahead of time and the word's out, but I think people just want to get in there and see what's left.
Yeah, thank you for that. I completely understand that. I mean, I completely understand that people would want to go in and start working on it. And I know it's probably challenging to have to wait, but what we really don't want is additional risk coming to them later. Commissioner Hunt, other questions or comments?
Again, I would just ask if people are looking for possible contractors or other resources. There was a packet that was handed out, but I'm assuming that those packets are no longer, I guess, being handed out. So those resources are available at our county website.
Yes, the packet is posted on the emergency services pages in both English and Spanish.
Perfect. Thank you.
Okay, so
Commissioners, maybe a couple of comments while we're on this. And I'm sorry, I probably should have indicated to you before we went into the specifics here, the idea of bringing together a number of agencies and services all in one location up at the outlet, outlet stores in Lincoln City is something that we're standing up right now. And Jess Palma is here and can talk about that multi-agency resource center. It's going to include Paul and Roy, and then Anno Husing and staff from building and subsurface are part of the group that's going to go up there. But many more agencies and services will all be available over the course of 3 days, and including FEMA representatives. But we can let Jess Palma explain that a little bit more. Before she does that, I would like to talk a little bit about the solid waste side of things too, because we did have conversations this morning with North Lincoln Sanitary, who is our franchised waste disposal service up in North Lincoln County. And we are doing some things with them in order to actually provide a site for licensed contractors to assist in really staging some of the materials that have come out of this particular disaster, so that we can get them to appropriate landfills for placement in those landfills. That's going to require us to do some changes. I think I talked to you last week about some changes in our franchise agreements, some additional new services that'll be provided by North Lincoln to handle the particular wastes that will occur here. We're putting together all that information, and that should be available by tomorrow when they stand up the multi-agency resource center. So there's a lot more things going on. I did want to just echo what Paul was saying about, we are concerned about people who may not have resources or insurance to cover these costs. And so we're continuing to work with OEM, with FEMA, and with some of their state and federal partners there to see what we can do to assist in that process. It's going to take time to put that together, but we continue to work diligently to make sure resources are available to assist people. So with that, and maybe before Ano and his discussion of what they're doing on the planning side of things, maybe Jess Palma can tell us specifically about the times and location for the multi-agency resource center.
Go ahead, Jess. Yep, great idea.
Good morning, or rather, good afternoon, everyone. Jess Palma. I am doing several different things in our Emergency Operations Center. Just like Wayne said, we are setting up the MARC, which is the Multi-Agency Resource Center. That will actually be happening this week, and the hours are a little different, so bear with me if you've got your pen ready. On Tuesday, we'll be open from 3 p.m. to 8 p.m., and then Wednesday will be 1 p.m. to 8 p.m., and Thursday, 8 a.m. to 1 p.m. We're trying to have some different shifts available, to accommodate different working schedules, childcare, all of that sort of thing, because we know that people have a lot going on, especially right now. We are reaching out to different agencies, both local and at the state level. We will be lucky enough to have FEMA there, and they'll be able to help people get signed up and fill out their paperwork. We know that, this is an overwhelming process. There's a lot of information, and each agency requires different things. So our goal here is to have as many agencies staffed at the event as possible, so you can hop over, and get your FEMA paperwork done, and then go visit utilities and see what's going on with your account or what you need to do there. So we are still getting confirmation of what agencies will be there. We're going to let out the announcement later today. As far as our list, I don't know that we'll have a full detail of everyone that will be there, but we'll let out the days and times, and then also the location, which will be at the Lincoln City Outlet Mall, Suite 200. That is right next door to our donation distribution center that we've contracted out. And then it's also right across, the street is not the correct word, but it's right across the walkway from the trauma support center that we've also established over there. For transportation and things like that, people can, Wayne, you might correct me on this one, but they will be able to contact either Dial-A-Ride, or they can use our county transportation. And then we'll also have some computers on site at the resource center so that people, can fill out those online applications and things like that. We'll have free Wi-Fi for them, some snacks, and really, just those resource lists and those people that they can meet with and get their needs met right there. Yeah, I'm happy to take any questions.
Jess, I was writing as fast as I could. I have Tuesday 3 to 8 p.m., Wednesday 1 to 8, and Thursday 8 to what time?
1 p.m.
1 p.m.
Oh, sorry,
Okay,
I was double muted. Yes, to 1 p.m.
Yeah, thank you for that. I also think it's important for us to at least get some of our elected officials there, or some of our elected officials representatives. So now that the dates are essentially scheduled, I know there was, not sure exactly when it was going to happen this week. I will reach out and see if we can get some of our Coastal Caucus members there, as well as some of our field staff from our federal elected officials, because I think it's really important for them to understand where the barriers are for people so that they can help fix them. It's one of the reasons I think working in the call center, which I know all three commissioners, as well as some of our legal counsel and other elected officials did, was so important, because we got to actually see and understand where some of the disconnects and barriers were and fix them. So I will work on trying to get some people up there, and we'll look at my schedule as well and try to be up there as I am able as well. So thank you for doing that. Commissioner Hall, questions or comments for Jess?
Only a comment to say that this is great, that this has come together and come together very quickly. Thanks for everybody for all the effort.
Yeah, and I guess one more thing I'll say is, given that Jess hails from public health, although she's doing all kinds of things from us right now, I'm just assuming that all COVID precautions and social distancing and all of that kind of stuff, mask wearing, is going to take place, because I know her and know she wouldn't plan an event where those things were not taken seriously. So just so the public knows, I know that social distancing and mask wearing and hand sanitizer and all of that will be going on at that event as well.
Yes, thank you so much for saying that. We'll also have masks available if people have forgotten theirs or if they need to change theirs out. Of course, hand sanitizer everywhere, proper distancing with the floors marked and things like that. And then we'll also be just keeping an eye on how many people we have in the room at one time. And, you know, if we need to, we'll have people wait outside or utilize the other services until we can get them into our main building. And then I just wanted to add one more thing. As I was working, last week and through the weekend on this particular task, one of the things that the other counties let me know was just really emphasizing the need for privacy at these events. So, making sure people are really respectful. Of course, right, we all know how devastating this is, and we, unless we're experiencing it ourselves, we can't really imagine the full magnitude of the situation. But just being really mindful about press and media and things like that, and not taking pictures and videos and things like that on the site, and just being really mindful and respectful. And so, just so the public and everyone else knows, just keeping that in mind, with the resource center, and just making sure we're conscious of everybody and everything that's going on around us.
Really, really good thoughts. And hopefully the public that's not directly impacted can hear that message as well, and stay away and let people have their privacy as they navigate through that. Commissioner Hunt, questions or comments for Jess?
No, I think the one question I had was answered. I've had people inquire of me of where they can make donations, and I think that question was answered, although I have had people ask where they could make cash donations, and I'm not sure that that is clear.
I am happy just to give you a donation update as well. Sorry to take up so much time on your schedule, but I know these things are important and we're all eager.
Appreciate the answer.
So we have been lucky enough that the county has been able to contract out with a few different agencies. So for donation reception, we have a site that is open at the Lincoln County Fairgrounds. Yes, I know that this is a Newport location. That is because we have access to that building at any time that we need. It's a huge facility, and I mean, there are warehouses full still, throughout the county and everything where donations have been made. So those volunteers, it's actually Erica, who is the president of Focus, which is Friends of Lincoln County Animals, and then her team, which is a bunch of Hatfield Marine Science Center volunteers. They're working so hard to gather those donations that have already been collected or have already been made. They're taking an inventory, making a list, and then they're shipping them up to the donation center that we have contracted out to the Lincoln City Foursquare Church. They are set up in the mall, and so each day shipments come from the donation reception site up to that donation distribution center. And that's where those are being made. I was waiting. I know that it's tricky because we're a government agency. I think we have to have, some official clearance as far as when we're recommending financial donations. So I've just been waiting to hear who we can or can't endorse. So I don't have an answer, but Wayne might.
There's a number of, I think the call center has a list of a number of places you can donate. I think the real concern has been trying to get one that's locally focused. I know there are some GoFundMe accounts out there for individuals. And we do know that the United Way of Lincoln, Benton, and Lynn counties has a wildfire fund that you can make contributions to. They do not provide services directly, but instead would fund other nonprofits locally here in Lincoln County that are providing assistance. And I do know, though this is not an official recommendation, but Angels Anonymous, which is a long time nonprofit in North Lincoln County, has been providing direct services and funds to people who are victims of the fire since this started. So that's at least some of the organizations you can consider, as well as the Red Cross or Salvation Army.
And could I jump in with a question? I'm sorry, related to this. Would it be appropriate to mention, there are numerous unofficial, at least not in partnership with the county, but large donation and collection sites operating independently. And I just quickly jotted down 3 very large ones, if we could share that for people who are still interested in donating food, clothing, personal care items.
Sure, I think that's fine.
Okay, I'm seeing some nods. The one that's closest to the fire area is at the Rose Lodge Grange. They opened up just the end of last week, and I know they're operating 12 to 3 daily. Beach Baby Resale in Lincoln City has even rented out extra warehouse space behind their business, and they've got a really large operation going. And then also in the space kind of between the Happy Trails Feed and Tack and the old Red Cock clothing store in Lincoln City, if that helps people place it, there is a great, large, well-organized, essentially walk-in store where people can come in and access those kinds of items or donate them.
Okay, thank you, Commissioner Hall, for that. Lots of ways for people to be involved still on helping these individuals and families that have been impacted. So, and thank you, Jess, for all of your work. Wayne, anything else from you?
I think I might have some concluding comments, but let's let Anna go first and talk about the planning department.
I know we do have our OHA director on, so he is standing by, but we will try to get through wildfire before we jump into our other emergency. So Anno Husing, planning director.
Yeah, good afternoon, everybody, and my deepest condolences to all the people that have been affected by the fires. I've had an opportunity to speak to many of them already. Got to tour the site last week. It's really something to try to wrap our arms around and comprehend. Bottom line is that once we're through this thing, I want to make sure everybody believes in Lincoln County that at least our planning department was not a stumbling block in terms of issuing the kinds of permits and doing the things that we need to do on the permitting side of this so that we can get that community back up on its feet and providing the important housing and lifestyle choices that people have made there to be in that community. So we are going to do our darndest to make sure that we are not sort of a choke point on trying to make sure that the recovery happens. To that end, what we're doing is we're diving down deep into our records, and we're going to be pulling out and creating a database that's going to be countywide in terms of all of our different departments, so that we have at our fingertips for everyone that's working to get back to get their homes rebuilt and get back onto those properties, so that all of the information that's required is not going to have to be pulled out one person at a time. We're going to dive into this stuff and create a big database again and then get that information out to people. So that's extremely important, and I think that's going to yield a lot of results. I know a lot of people's records have been destroyed in the fire, so thankfully a lot of that stuff is at our planning department in hard copy form, so it's getting digitized and will be made available for people. I do want to echo just a few things that have been said earlier, that what would be to me a horrible outcome of this is that people do try to get back onto their properties too quickly, try to engage in cleanup too quickly, because in addition to the personal health effects of handling this material, having other people handle this material that are not equipped to handle this material, what I'm deeply concerned about is that people start getting on their properties with heavy equipment and start doing things, and then they damage their properties even more. In particular, I'm talking about the septic tanks, because that entire community, both Highland Estates and in Panther Creek and Otis, that whole area affected by the burn, everybody's on septic tanks there in drain fields. And so we don't even know yet how badly damaged stuff is that's underground. But again, if people get in there, and I totally understand the impulse to try to want to get your life back by getting onto your property, getting it cleaned up, getting a new house ordered, all those kinds of things. But I think it's going to make so much more sense for everyone to just slow down. We're all going to know an awful lot more about the resources that are going to be available from FEMA and other places. But we also want to get right back down to the property owner. We want to be able to provide to everybody that's been affected by the fire information about their own property, information about where the septic tank is, where the drain field is, so that all of that can be fenced off and protected as the cleanup happens. And so again, some people may know exactly, especially if you've built recently, where your septic tank and drain field are. Some people don't even realize they have a septic tank and a drain field. But if you screw up your septic tank and drain field, you may not be able to occupy that property at all, because septic has to be there to be able to serve property. So again, I just want to ask people to slow down, try to keep their emotions in check. Of course, we're going to, we'll all put this behind us. On the permitting side, we want to have all the permitting ready to go. So when those properties are safe and cleared, and we know what needs to happen with those septic systems to get them operating again, that at that point, we'll see a rapid redevelopment of the community, because we've thought about this in advance. We've worked the bugs out of the system, and that when people actually do get back to their properties, it's going to be safe, and they're going to be able to occupy their properties. I think the other thing that I'm hearing too is that we don't even know how long it's going to take for water systems to get reestablished in those areas that have been affected by the fire. So there's an awful lot of things going on. There are an awful lot of very smart and dedicated people and experienced people that are spending night and day trying to figure out how to make this whole experience get put in the rearview mirror for all of us, so we can look back and say, maybe this was Lincoln County's finest hour, that we all responded, that the entire county pulled up its socks and did what it could to get people back into their homes. But that again, there's that one big caution I have is, please go slow, have a plan about what's going on. We're all going to learn an awful lot more, and you're going to see a lot of information coming to you very soon, because I know people are going to be allowed to be back on their properties. And so that's why it's so important at this very early stage to have that kind of messaging, like, work with us. We're here to help you. We're all going to get back on those properties, but let's make sure we do it in a way that really is smart and safe. So thank you for that. I'll be happy to answer any questions.
Thanks, Sano. I also know from an earlier conversation with you today that you will have staff up at the outlet malls later this week for the multi-agency resource centers. I think it'll be good to have planning department.
We look forward to that, and many people will know our staff already. And just in case, folks, that you can't make those meetings, we're still available to help you. So contact us by phone, whatever. We're standing ready to provide you information and to get you the permits and the assistance you need to get back up on your feet. Thank you.
Thanks, Ano. Commissioner Hall, questions for our planning director?
None at this time. Thanks, and thanks for the commitment and the effort.
Commissioner Hunt, anything for Ano?
No, again, emphasize the fact that we ask people to be patient and don't be afraid to ask for help and seek resources.
All right, Wayne, anything else you'd like to do to summarize Wildfire?
Just one final comment, and that is that there actually will be targeted information provided to people who are impacted by the fire through Lincoln Alerts. So we do have information and can get out to specific folks who were suffered losses during the fire. So that information will be going out pretty shortly.
Great, thank you. That's good to know. And a nice plug, if you are not signed up for Lincoln Alerts, to get yourself signed up, which you can do on our website. All right, taking a little breath here and moving down on our agenda. Lincoln County Public Health COVID-19 update presented by Rebecca Austin and our Public Health Director. And we're going to kind of move from that update right into our phase 2 discussion. I know Director Allen is on the call with us. So Rebecca, we'll start with your update and then we'll move into phase 2 discussion from there. You're muted, Rebecca.
Sorry about that. So this is Rebecca Austin, your Health Department Director, and we have the data for the last week, I do believe, and it is looking really good. Just so you know, we have 1 new case today, and we had 2 cases over the weekend, which brings us to a total of 473 total cases. We have had 8,420 negative tests, 23 hospitalizations, nobody currently in the hospital being treated for COVID, and we're holding steady at 13 deaths for the county. So you can see from the first graph the cases, and if you look to the far right, that is week of September 16th. And yeah, we have very few cases. I love it being down there just like it was before our big outbreak on the 8th of June. So that's a good place for us to be. And the next one shows the chart that shows our testing, how many tests we've done. Remember, the brown is the negative, the green bars are the positive, and then the squiggly line that kind of goes up and down is our positivity rate. And if you can see again to the far right of that, and all the data is not yet in for all of that, but and you can see that we've slipped a little bit in our testing, but I think that'll probably come up in the next report. So it's kind of wobbling right around the 250, 300 is kind of where we've been leveling out for the last almost 2 months now. And then our positivity rate has really dropped remarkably. So that's all very good news and something that we want to see at a very low rate for phase 2. So then the next is just some demographics. The blue bars show the COVID cases by age group, and nothing has changed from the last time you saw that, really. It's about the same. And the following one is how we divvy up the age groups by the type of case it is, whether it was a household, an outbreak, or sporadic or community-based. And so you can see that outbreaks still are sort of running the show, but that even seems to be improving. So we've had a few potential outbreaks that could have happened, but were averted, which we're very pleased about. So, and this is our 2nd week now after Labor Day. So, you know, we are all kind of holding our breaths for that date to come and go. And so we seem to be kind of holding our own. And I think if you want, Katie, I can turn it over to Pat Allen to see if he has anything new to add. But as far as and I think many of you saw this last week, we were sort of celebrating meeting all of our phase 2 metrics for the reopening criteria. So we got a few black dots, which meant that we didn't really have enough data to put us on the map. And the other 3 where we did have enough data, we got the green checkbox. Here it is for you here.
Yeah, and I would just add that in this case, not having enough data is a good thing. So other times it can be bad, but that's the black dots are good.
The black dots were good in this case, yes.
All right, I guess with that, well, Wayne, do you want to kind of give us a little walk down memory lane just on where we are with phase 2 before I turn it over to Pat?
Sure. Commissioners, we had made our application to go into phase 2. Decision was made to extend the requested target date to September 29th, but with the idea that we would be checking in with OHA as we got closer to that date to see where we're going, what the trends are, both in Lincoln County and in the state. The concerns that we might have as we go forward, but otherwise make sure we're on track to utilize that September 29th date. And I do want to make a note. I think this might be a good time to indicate that the 24-hour lodging hold also targets the 29th as that date. Originally, we had set the removal of that particular hold to coincide with moving into phase 2, but then you extended the date to a date specific to the 29th. So that's also on our discussion. If we don't do anything to change it, that would also be lifted on the 29th if we go into phase 2. So with that, I'd be willing to answer any questions.
I think if you see nods from Commissioner Hall and Hunt, I think before we stop for questions, I'm going to go ahead and let Pat go. And then from there, we'll do questions. And I see a nod and a thumbs up. So, all right. So Director Allen.
Happy to be here. Can you hear me?
Yep, we hear you. Thank you for being here with us. I know you had technical challenges seeing us, but we hear you just fine. And I think our biggest reason for having you here today, which I think is a kind of change. I think when we originally wanted you here, our data was maybe not as good as it is today. So we needed OHA to kind of make a judgment call and provide some more information to us, but it's looking much better than it had. But I guess mostly we just want to hear from you on whether or not Lincoln County can indeed move ahead with phase 2 as we're hoping to.
Sure, I appreciate the opportunity. And first, I just do want to compliment Rebecca Austin and her team, and really everybody in the entire community across Lincoln County for the work that you all have done to get these numbers to where they are. You're one of a couple of counties that I regularly point to as just standout examples of how jumping on a problem using basic public health tools and just really working the problem and running it to ground really does make a difference. And when you think back to how widespread coronavirus was in the community back in June and July, it's really incredible how far the entire community has come. So I just wanted to acknowledge that. We won't have this week's updated numbers until a little bit later in the week, but based on what I know about your case counts this past week, it's as Rebecca indicated, you meet all of the phase 2 metrics, and the trend is good. And I don't anticipate anything changing in that when we look at those numbers on Wednesday. And so I think you're in great shape to be able to move to phase 2. You also asked a little bit about kind of statewide trends. That's a lot murkier circumstance right now. Our testing volume has kind of fallen off a cliff over the last couple of weeks. We expected a little bit of a drop off in testing the week of Labor Day because the long weekend always means that fewer people are getting procedures and just fewer people actually get tested. But then, of course, the wildfires hit, evacuations occurred. And then most especially the smoke caused lots of medical providers to cut back or eliminate elective procedures and all kinds of other reasons that people would get tested. And so our testing numbers are quite low. And what that really means is case counts are up, We don't know whether that means we're seeing, well, we don't know what we're seeing exactly because we don't have enough testing to have a good sense. There are a number of things that are all happening in that period of time around Labor Day, around kids moving back to Oregon and Oregon State campuses, Portland State as well, potential effects of evacuations and those kinds of things. And so there's just a lot of noise in the system right now. I'm hopeful that this week and next, the testing numbers will rebound and give us a clearer picture. But clearly, we have more cases in the state, and we're on a bit of an uptrend right now, and we'll be working the various outbreaks and other circumstances in other counties to work to get that tamped back down again. Be happy to answer any questions you've got.
Well, first off, I'm just happy to hear that we have come down. I agree with you. Big thanks to Rebecca and her team for working through that with our community, and a big thanks to our community for taking this seriously and wearing masks and doing what all of us need to do. So thank you for that. I don't have any questions at this time, but Commissioner Hall, do you have any questions for Wayne or Rebecca or Director Allen?
I do have one that I would direct to either Director Allen or Director Austin or both. Given all of this information, I don't think I'd have any reservations whatsoever in supporting going to phase 2 on September 29th. The one concern, and I just like your feedback, I know there was the temporary interruption in processing tests in the state lab. I don't know what, if any, impact the fire and smoke had on Samaritan's testing operations. So should that be a matter of concern for us as we look at giving the final green light?
Yeah, Commissioner, I think it's a great question, and I think the answer to that is no. The state lab was down due to indoor air quality for, I want to say, 3 days total. We were able to move those samples elsewhere, and so there was no actual interruption of testing in that period of time. I think I don't know the specific details at Samaritan, but I think what's really been depressing testing numbers is a lot of testing occurs when people go in for some kind of a procedure and they get a screening test ahead of that procedure, and those are overwhelmingly negative tests, and a lot of those have come out of the system in the last 2 weeks. And again, I don't know Samaritan specifically, but as those build back in, that'll give us a more accurate picture of what's going on statewide. But your numbers for this last week are really consistent with the trend they had been heading on, and so and they could be significantly higher and still not be a problem in terms of phase 2. So I'm as I look at that circumstance, I don't see anything that makes me concerned that we don't know enough to move forward.
So this is Rebecca, and I would definitely agree with Director Allen on that, and to say that this has been a trend we've been watching for the last couple weeks. It's not just, a moment in time. So even though we did suffer a little setback in some testing because North Lincoln Hospital was closed during the wildfire, they got back up and opened pretty darn quick. And from what I understand, they're pretty much at full tilt now. So I think we will definitely be watching this, and don't forget we still have another week. So if something blows up, we can always, reevaluate. But so far, I think we're feeling pretty good about it. And the other thing I would like to say is that we have learned a lot more about our community, and we know where there are some trouble spots, and we are working very diligently with employers and of course with the schools and the college to really try to get ahead of any problem areas that we see coming. And my staff is getting really good at figuring out what could go wrong, and just, that prevention piece is so important. And even with the evacuation center, which we were, we all had some concerns about, because 250 people in one building overnight is really challenging for COVID prevention, but so far so good. So I think the community, I agree, the community has done an outstanding job in really trying to cope with one problem at a time, one crisis at a time. So I really appreciate that.
Great, that's very helpful. Thank you both.
Commissioner Hunt, questions?
Yes, I have a question. I'll direct it to Director Allen. Lots of conversation in this meeting about testing, and it's comforting to know that the testing numbers have, I guess, been relatively stable considering a fire. But what about the larger testing issue as far as access to testing kits in general? It's been my understanding that because of the nationwide demand for testing, that the ability for the state of Oregon to get I guess what we would say would be the desired level of testing kits has been a consistent challenge, or certainly recently a bigger challenge. Is that situation improving? What's the recent trend, and how challenging is it to get the necessary testing materials?
Yeah, it's the situation is definitely improving. We're getting testing resources pushed out by CDC and Department of Health and Human Services in a variety of ways. We've received directly at the state a large supply of antigen tests. They've been releasing materials to nursing homes around the country. We still suffer from our own success and tend not. We say we have the 4th lowest infection rate in the country, the 6th lowest fatality rate, and so we don't get prioritized for resources the way other states that have higher disease rates are. And so that's kind of an ongoing challenge. We've also sort of got a demand challenge a little bit. It's actually not super helpful when the Pac-12 comes out and says they're going to test every player every day, because that creates an expectation that, well, if that's good for football players, it should be good for everybody. And there's not only is it not really useful from an epidemiological standpoint, there just aren't the resources to be able to test 4 million people every day. And so we manage that pretty consistently. One of the biggest things we have to manage is the usefulness of testing people who don't have symptoms. Because if you have coronavirus and don't have symptoms, your false negative rate is 30 to 40%. And the challenge there is most normal people, when they go in and get tested and they get a report back that says they tested negative, they think that means they don't have what they got tested for. And with coronavirus, it does not mean that. And so that's an ongoing challenge, especially with asymptomatic contacts of people who have tested positive, who we want to quarantine and isolate regardless of what their test results are. But in general, the situation for testing volume is improving. We also have a proposal into the legislature working with Oregon and Oregon State to use some new technology to significantly increase it yet further and have that be sort of domestic capacity that we can rely on here.
Thank you. And you couldn't see it, but you brought a smile to my face when you said we're kind of victims of our own success. It's, I guess, a nice place to be, but it does have a disadvantage. So thank you for that. I guess I would just conclude with a comment that, again, I think the work that our public health department has done has been outstanding. I will give credit to our governor for the mandatory masks. I think that has been a very significant factor in reducing the spread of the virus. And I think between the efforts of prevention by our public health department, the efforts to work with employers and the schools and anticipate where outbreaks might occur have really been critical in our ability to reduce the level of the positive tests, which to me is really the critical indicator. So I certainly at this point am comfortable with moving to phase 2. but I think I'll have to throw out a couple of cautionary notes in that certainly the fire and the interaction of people fighting the fire, the opening of schools, and frankly, the lower level of testing, I think are things we certainly want to be watching as we wait out the next 7 days toward reopening to phase, or moving to phase 2.
Okay, and I don't have any other comments. I'll see if Wayne does here in a minute, but I guess I would just say that Director Allen, if something changes in the next 7 days, obviously Rebecca would let us know as well, but from your guys' perspective in approving us to go to phase 2, if something changes and that's concerning, please just reach out so that we kind of know what's going on. We know that Thursdays is when new data comes out, but if anything changes from your end, please reach out and let us know. I don't think any of us want more surprises right now. So if you see trends ticking up, and Rebecca, you as well, if you've seen things, coming up that are alarming, let's get together and do a special meeting, whatever, to discuss. But for now, it all looks well. Wayne, do you have anything you wanted to add?
No, I think you've covered it well.
I'd like to just say a special thanks to Director Allen for joining us at this meeting. I know his days are very, very busy, but thank you very much.
Happy to do it.
All
Chair
right. Well,
Jacobson?
yes, go ahead, Claire.
Just I have a procedural question at this point, and maybe I don't know if Wayne would advise us on it on this, but it seems like the consensus is, barring unanticipated developments, we are going to phase 2 on the 29th. I mean, do we need a vote to reaffirm that? I mean, I'm sure, there are many businesses that will be impacted by this. I mean, is there some way we can give them the reassurance that, barring something spectacularly unexpected, that phase 2 is go on the 29th?
Well, procedurally, you have made the request officially to go on the 29th. And unless we hear something that says we can't go on the 29th, or you tell me otherwise, that's what will happen.
Sounds good.
And Director Allen will be in touch if something happens to where we can't go on the 29th. But at this point, all systems say go, I think, unless something else comes up.
And I think we would likely send you a letter on probably Thursday confirming that you continue to meet the metrics as outlined in the governor's previous letter.
Okay, great. We'll look forward to that letter. Thank you. Okay, I guess with that, we will wrap up COVID. I'll ask Christy to bring back up our agenda. And Director Allen and Director Austin, for that matter, feel free to get off if you need to. I really appreciate both of you joining us today. Okay. Let's see, we still have to do a little bit of C, which is our 24-hour lodging hold. I accidentally missed that one. Wayne, 24-hour
Sure.
lodging hold.
Again, what you had done when you extended the lodging hold the last time was actually picked a date specific. It would actually expire on the 29th unless you change that date. So it'll coincide with going into phase 2. Unless, again, you wish to revisit that for any reason.
I guess just for a point of discussion with the other commissioners, I guess I am not sure why waiting till the 29th at this point is needed. I think our numbers look really well. The other jurisdiction cities don't have a 24-hour hold, and I know that there is a large percentage of people evacuated from fires currently staying at lodgings in the unincorporated areas. So the lifting of that rule may help a little bit in their capacity to serve that population. So, it's the 21st today, and I'm not sure what an additional 8 days of waiting would really buy us. So I guess I'd be inclined to let it go now, but because I'd like to hear thoughts and comments from others.
I'd agree with your reasoning, Chair Jacobson, and would be willing to make a motion to that effect that the hold be lifted immediately.
I guess I feel that I don't see a compelling reason to make a change in what has been our approach all along, that we would keep it in place until phase 2. And I think that probably most of those properties are heavily booked because of the the wildfire situation. So I'm not sure the 24-hour hold is really an adverse impact.
Commissioner Hall, did you want to make a motion?
I would, you know, with respect to everybody's perspectives on this, I would like to make a motion that the 24-hour lodging hold in the unincorporated areas be lifted effective immediately.
I will second that motion. All in favor say aye.
Aye.
Aye. Nays?
I'll vote nay.
Okay. All right, motion does carry with Commissioner Hall and Jacobson voting yes.
And I will prepare an order for your signature, which reflects that decision.
Okay, thank you, Council Belmont. All right, let's see, we did that. All right, and now we're on a D, Resolution 2021-9A STR Licensing Program Moratorium Extension presented by County Council Wayne Belmont.
Commissioners, when we discussed the STR situation the last time, the one item that needed to be considered and acted upon was the licensing program moratorium. You'd had extended that through September 30th previously, and the consensus last week was actually now to extend it again through December 31st, 2020. So I prepared the appropriate resolution to do that. So if I can get a motion on that, then we can proceed with that matter.
I'm sorry. Go ahead, Claire. I had distraction. I'm sorry.
That's okay. I would move that we adopt Resolution 20-21-9A, extending the STR licensing moratorium.
I'll second it.
Okay, a motion and a second. All in favor say aye. Aye.
Aye.
Aye.
All right, motion carries. All right, on to item E, Health Center Quality Leader 2020 HRSA Quality Improvement Award presented by Rebecca McBee Wilson.
You know, Chair Jacobson, if I might, I'd like to take just a moment to offer some comments. I think if we remember back 2 or 3 years ago, we had some challenges in our Health and Human Services Department. The 3 commissioners at the time agreed to co-directors, Rebecca Austin and Rebecca McBee Wilson. And Rebecca McBee Wilson, you know, unfortunately, we have 2 Rebeccas. I guess the good news is it's easy to remember their first names, but sometimes different first names would be helpful. But Rebecca McBee Wilson is the director that really oversees our health center, which has, and I guess depending on how you count 5, maybe 6 locations in our state. But I think it's significant that for 3 years in a row, the health centers have received this award. And that's why I asked Director McBee and other members of McBee Wilson and other members of her staff to discuss this award and get the recognition that it certainly deserves.
All right, Rebecca McBee Wilson.
Well, thank you. I would also like to introduce Val Davis. Val Davis is the Deputy Director of Quality and Risk Management for the Health Center, and she's going to be sharing this presentation with me today. We're both very happy to be here today to share the good news of Lincoln Community Health Center's award as a National Quality Leader. Before we do that, I would like to just kind of talk a little bit about what a health center is, because you all know what a health center is, but many people in the community do not. We are one of 1,400 health centers across the country. Federally qualified health centers were first established in 1964, and the mission is to really serve the underserved populations and underserved areas across the country. And rural America definitely fits both of those categories. Lincoln Community Health Center was founded in 2006, and it's in partnership with you as the Board of Commissioners and also the Lincoln Community Health Council. And many people come into our centers and don't know they are part of the Federally Qualified Health Center program. And so if you've been at a primary care clinic at 1010 or Devil's Lake Boulevard by the Motor Vehicle Department, or any of the 4 school-based healthcare centers in the high schools, or behavioral health programs, or maternal child health, or immunizations, you have been in and served by folks who work in the health center. Last year, we saw a little over 5,000 patients, and that's about 10% of the county population. And so we always like to let people know that we're here and we're ready to serve them at 8 different sites. So if you could move the slide to the HRSA National Program Goals. We'll go down one more. And Val is going, that looks like a blank.
Yep.
Well, that looks like a blank slide.
Looks like a blank slide.
Okay, well, you want to just tell them what the health center goals are?
I sure can. So there's 3 main goals. The first one is to increase access to care, and health centers do that by several different ways. One of them is to increase new access points, which we have not done yet, but we have explored an access point possibly in Yachats. One of the things we have done to increase access to care in one of our sites is to open our Newport School-Based Health Center. We convert that to a community clinic in the summers when we have the capacity to do so, and it's been extremely helpful during COVID-19 to have that health center, school-based health center open. Other ways that we increase access to care is through telehealth services, which we've really ramped up this year for obvious reasons. We've expanded hours in some of our clinics outside of the normal 8 to 5 hours to provide that extra access. And we've also implemented some new staffing models, including hiring our community health workers to help with screening for social determinants of health, and embedding a psychiatric nurse, mental health nurse practitioner in our primary care site. The second goal is to advance quality and its impact. And we do that through measuring and monitoring and providing outreach on 20 different clinical quality measures. We also do that through referrals to community-based services and use of technology to improve treatment and reduce the cost of services. The third goal is to optimize our operations, and that's done by providing staff training and development, through technical support, through our electronic health record, both on-site and through our vendor, and then through some quality improvement projects, quality assurance activities through our monthly quality assurance committee, internal auditing, and incident report and tracking. Next slide, please.
There it is. It's on there.
Let me get back to the, okay. Yeah, these are really big on the screen for some reason. So the next slide should have like a blue ribbon on the upper left-hand corner. And that's our quality improvement awards. And the way that they're determined is through our uniform data system reporting, which is our federal annual report card to HRSA. And that includes information on those clinical quality measures that I mentioned, as well as financial and demographic data. And so the awards are meant to recognize those health centers and to support them. And these health centers, they display high levels of clinical quality performance, and that's through improved health outcomes through those clinical quality measures. They support health centers that increase access to affordable and accessible care, And that's through things like same-day appointment slots, expanded hours of operation, and our sliding fee scale. They support health centers who achieve health equity and enhance population health. And that's through our social determinants of health screening and referral program. And then the final is to support health centers to continue to strengthen their quality improvement culture. And we do that through engaging our staff in quality improvement projects, policy development, encouraging staff to be curious and ask questions, focusing on processes of improvement, and we celebrate our successes. Next slide.
So I just wanted to point out the Health Center Quality Leader has 3 tiers. There's the gold, which is the top 10% of health centers, the silver, 11 to 20% of the top health centers, and there's a bronze, which is 21 to 30% of the health centers. These are people in the top tiers of health centers. So, so if you could show us the next slide. It's also blank. I'm sorry because what I did was I found all 3 of our last 3 years of awards, and we were wanting to bring those up so you could see it. So in 2018, 2019, then again in 2020, we were fortunate enough because of the great work of our staff to fall under the top 11 to 20% of health centers. And there's only 2 of us of the 33 health centers in Oregon that have been recipients of this award 3 years in a row. So I think it's quite an honor to be in that company. So Val?
Okay, we're on the next slide. So we should say have something around with 117 million in the title on this slide. So HRSA awarded over $117 million were in quality improvement awards nationally. And you can see, maybe you can't, I'm not sure, the different award categories. Lincoln Community Health Center was awarded $73,845 this year. And what makes, we were awarded in 3 different categories. The first one was the Health Center Quality Leader, and we received $28,095 for that award. We were one of 384 health centers in the nation who received that award, and one of 4 in Oregon this year out of 33 health centers to receive that award. The second part of what makes up the full award is advancing health information technology for quality. We received $5,750 for that, and that includes things like advancing telehealth and collection of the social determinants of health data so that in order to increase access to care and advance quality of care. And then finally, we received $40,000 for achieving patient-centered medical home recognition. And in Oregon, that program is called PCPCH, Patient-Centered Primary Care Home. We have 3 recognized clinics. 2 are our main primary care clinics, and we are at tier 4 for both of those. And then for the first time, we've had one of our school-based health centers recognize the Newport Clinic at a tier 3 level.
I would just like to say the patient-centered medical are really, they have very stringent standards that you have to meet, and we would not be able to meet that without our, our behavioral health, because having integrated collaborative care is part of that. So having behavioral health being part of the health center and working together is really helpful in achieving that.
And the next slide is about the use of the QI award funds. There are certain restrictions. We do have flexibility on how to use these funds. There are some restrictions, and the funds have to be used within a certain time frame. So we have until December 31st of next year to use the 2020 award funds. And it's use it or lose it. So how we've used the award funds in the past and how we're probably going to use a lot of that this year in a similar way. I would say probably 30 to 40% goes to staff training and education. We were really heavy on trying to get as much specialized training for all of our staff members, both clinical and administratively. to help learn about health centers and how to run them and how to improve care and reduce cost and improve the quality. The second thing that we've got listed there is electronic health record enhancements. Some of the things I can think of, like right now, we're implementing welcome tablets, which are for patient check-in, and we're also implementing Drag and Dictate, which is a dictation software program for providers to improve their documentation. And then we've purchased medical and computer equipment, some furniture and exam room supplies, as well as some computers to enable our staff to do telehealth from home and to telecommute. And we've also purchased consulting services and do a lot of marketing around Health Center Awareness Week to increase awareness in the community about the services that we offer and about our health center. And then finally, we used some of the funds last year for strategic planning for the HHS 5-year strategic plan. Next slide. So we'd just like to really say congratulations to the staff of Lincoln Community Health Center. They are very dedicated to quality improvement and patient-centered care. So congratulations.
And of course, we wouldn't be able to do it without each and every one of them. And so we recognize that they really do. They're always wanting to do the very best for the patients that they serve. And this kind of award shows that they reach that standard. Are there questions?
All right. Commissioner Hunt, this is one of the departments that you oversee, so I figured I'll start with you. Questions or comments for the team?
The cuckoo clock, I love it. I don't know if people can hear it or not, but I try to mute it. No, I really have nothing to say except congratulations. I think when you consider the significance of the award, it is certainly well-deserved. It speaks highly to the quality, caliber, dedication of our staff, and I would say my sincere thanks to all.
Commissioner Hall, questions or comments?
No questions, just really want to applaud the staff, and I hope we can figure out ways to spread the word far and wide about these achievements.
Yeah, and going last, all I can say is, yep, on what they said. So totally agree with the two other commissioners. A big congratulations, you know, not just for this year, but just for the last several years. I haven't been here that long, so I can't take credit for much of it, but obviously you've made a big commitment to these health centers and to having them be the best they can be, and that shows as you start racking up, you know, awards every year. So really nice to see not just the achievements on this particular year, but that this is a trend, and that's what we want to see. So big thank you to the whole team for doing that, and big thank you to Director Austin as well or excuse me, now I did it. Director McBee Wilson for taking this up and leading this effort. So thank you.
Thank you for the time that we could share the good news.
Yeah, wonderful. All right, if we can switch back to our agenda, I think we have one more item. Where are we? There we are. Okay, I think we're on item F now, Lincoln County Harm Reduction Program, presented by Amy Snyder, Health Promotion Program Manager in Cedar, and I never even try your last name because I don't want to butcher it, our Harm Reduction Outreach Worker.
Hello. Hi, I'm Dr. Amy Snyder. I'm the Health Promotion Program Manager. I identify with she, her pronouns. And Cedar, would you mind introducing yourself? It'll give you a chance to say your name correctly because I know I am at risk of mispronouncing as well.
My name is Cedar Derishapur, and I use she, her, and they, them pronouns. And I'm the harm reduction worker for Lincoln County Public Health.
Thank you. Will you go to the next slide, please? Thank you. So a brief overview. We're going to start with talking about addiction and recovery because September is Recovery Month. But then the rest of our talk is focused on harm reduction, generally just talking about the harm reduction approach, but also the effectiveness of harm reduction, our specific services that we have, our challenges that we have, and then what our county officials and our agencies can do to support harm reduction. And then the very last is I have some important links and contact information at the very end. Next slide, please. So addiction, just so that we're on a common understanding, the NIDA, the National Institute of Drug Abuse, defines addiction as a chronic relapsing disorder characterized by compulsive drug seeking, continued use despite harmful consequences and long-term changes to the brain. It also defines it as a complex brain disorder and a mental illness. There's a medical diagnostic term that's used for addiction, which is substance use disorder, which can be classified as mild, moderate, and severe. It's defined by 4 basic components: impaired self-control, social impairment, meaning that compulsive behaviors can affect relationships, work, and social life. Having risky use, which could be, for instance, using substances that have harmful substances in them, like fentanyl or infectious agents, and then having physical pharmacological effects, such as having tolerance developed and experiencing withdrawal symptoms. Next slide, please. So that takes us into recovery. Substance Abuse and Mental Health Services Administration, SAMHSA, defines recovery as a continual process of personal growth that involves many setbacks. And therefore, resilience is a key component of recovery, and that it's how fast someone can bounce back from a setback. There's 4 elements of recovery, and really to be able to be in recovery requires all 4 of these components. So the first domain of recovery is health, which is overcoming and managing one's disease, so one's addiction or substance use disorder, and the symptoms that are involved in that, such as withdrawal and cravings, and then making informed, healthy choices that support all parts of health, so physical, emotional, mental, social health. The second component is home, having a stable and safe living space. The third, purpose, having meaningful daily activities, independence, income, resources to be able to participate in society. And then the fourth is community, having relationships and social networks that provide support, friendship, love, and hope. And this is part of why we are participating in Recovery Month, because we agree with these and we contribute to these. But a key piece of understanding recovery is that everyone's journey to recovery is unique and it's very specific to them and their needs. So there's no 2 pathways that are the same. It looks different for every person, but of all, it has to be very centered in that person's need, but also has to be influenced by the environment that someone's in, the social and the service environment that they have. Next slide, please. So that brings in the harm reduction approach. So harm reduction has been an effective strategy to reduce risk whenever abstinence is not feasible, practical, or acceptable. And it can be used in a number of different topic areas. And so we happen to be talking about substance use and addiction here, and it's been effective in substance use and addiction since 1980s. But it's a different type of approach, and it's not always used well and used in the as widely as it could be. And so harm reduction as an approach centers on non-judgmental support at whatever stage of readiness someone is at, including being in a stage of not being ready for change, and we support that. It is oriented to the whole person, so it doesn't just target a specific behavior, but it really looks at what does that whole person need for them and themselves. It recognizes the influence of poverty, past trauma, discrimination, social isolation, and culture as components of the issue that somebody's experiencing. And then also ensures agency and empowerment of an individual to make choices for themselves. Next slide, please. So we use an syndemic model in harm reduction. And this is a term that describes synergistic epidemics, meaning that we have multiple public health epidemics happening all at the same time, and they're interacting synergistically, and they're increasing poor outcomes more together than they would as each epidemic happening on its own. So in order to combat substance use disorder, overdose deaths, sexually transmitted infections, injection drug use infections, and homelessness, mental illness, suicidality, all these things that co-occur together, we have to address things as a system with multiple levels of work through different agencies, and particularly with interagency, interdepartmental coordination and action. And that's one of the reasons why we're here. And we're in all of our, we're going to our city councils as well, and we're going to our Council of Law Enforcement in Lincoln County next month to just talk about harm reduction and ask for support from all these different agencies. We can go to the next slide. This next slide is just an example of what that model looks like. And I don't expect you to like follow this pathway through, but it just gives you a good visual of how interconnected these challenges are, and that we can't work independently on our own, that we really do rely on having healthcare with us, counselors with us, commissioners, different decision makers with us in this action, because it really takes a full systems approach. Next slide. So the effectiveness of harm reduction, the core component that's really at the center of the effectiveness of harm reduction, specifically for substance use issues, is that there's syringe service programs as kind of this effective evidence-based program that's used by a lot of harm reduction programs. So across the world, across the nation, harm reduction syringe service programs would have a number of different types of services, which often include syringe disposal, sterile injection resources, testing like HIV and hepatitis C testing, vaccinations like hepatitis B, hepatitis A vaccinations, and then linkages into care. So people who have been using syringe service programs, it's been found in research that they are 5 times more likely to enter drug treatment and about 3 times more likely to stop using drugs. They're 44% to 68% less likely to contract HIV, depending on the research study and the research population. About 80% lower rate of HIV, hepatitis C, and other bloodborne infections. Next slide, please. Additionally, in areas that have syringe service programs, it's been found that they have 20% fewer drug-related emergency department visits, that clients have approximately $1,300 to $3,000 cost savings per client, which would be healthcare costs as well as public service costs. In areas that have syringe service programs, there is about 8 times less improper, unsafe syringe disposal that occurs in that environment. It's also been found that there's an association between the increased distribution of sterile syringes and an increased proper disposal of syringes. There's also been found to be 67% fewer needle stick injuries in law enforcement in areas that have syringe service programs. So effective programs in a number of different sectors. We can go to the next slide, please. So here's the list of Lincoln County Public Health's harm reduction services that we provide. We can go to the next slide. I'm not sure if anybody else is seeing it. It looks like it's still on the same slide. Christy, if you can go down one more, it should say Lincoln County harm reduction at the top of the slide.
We might have lost Christy temporarily.
I'll go see if I can fix it.
Okay, thank you. Oh, there it is. Okay, we got it.
Perfect. So basically, Cedar has a list of harm reduction services, a menu, if you will. And since the core tenet of harm reduction is providing services at someone's level of readiness, what is provided to that person is going to be dependent on what that person is ready for and is asking for. But basically, this is the list. So tailored information that can be used to reduce someone's risk. Free rapid HIV and hepatitis C testing under normal conditions. We've been on pause on those since COVID started, but we're starting to revise our policies so that we can get back out there, which should be hopefully in the next month. We'll have CEDAR back out doing testing. Navigation to healthcare, mental health, and social services. So it could be anything from helping someone find a bed in a shelter or helping them access food through the food bank to actually getting into medication-assisted therapy or getting into counseling. Resources for basic needs like socks, first aid, or risk reduction such as condoms. Naloxone distribution to reverse overdoses, as well as training on how to use the naloxone. Free syringe disposal, which is open to anyone. It's a no-cost service, and it includes people who may have syringes for diabetic reasons who also use this service. And then also syringe exchange. And then if we can go to the next slide. There we go. So we have some of our 2019 data. There were 62 planned, and that should say planned instead of planning, sorry, 62 planned testing events that occurred in 13 locations. And I must say that wasn't CEDAR alone who did this. CEDAR worked with partners for the Confederated Tribes of Siletz Indians through their harm reduction program. So Francesca was the harm reduction worker at Siletz that did a lot of these events with CEDAR. And then now Francesca has moved on to another position, and we have 2 new harm reduction workers at Siletz, Chris and Josh, who also will be working with CEDAR to do harm reduction services. And they don't just do them just to the tribal members. They're often out in the community with CEDAR, providing services throughout the whole county. Through those 62 planned testing events at 13 different locations, there were 176 rapid HIV tests completed and 85 rapid hepatitis C tests that were also done. But of note on those hepatitis C tests is that they didn't start testing until August, when we got approval to do hepatitis C testing and a supply of hepatitis C tests. So those 85 tests were just done over a period of 5 months. So we did have a pretty high acceptance rate of those hepatitis C tests. And actually, we increased HIV test rates when hepatitis C testing was only provided with HIV testing. So it actually increased HIV testing by 20% when the hepatitis C tests were started. 140 safe sharps disposal containers were distributed through these harm reduction events. 16,000, well, more than 16,000 used syringes were safely disposed. And then just under 8,000 sterile syringes were distributed. And CEDAR actually looked it up today and found that since the beginning of the syringe service program, she has disposed, or her and her partners with Siletz have disposed of 70,000, just under 70,000 syringes, and then distributed 30,000. And so we're pretty much have a rate of disposing of more than twice as many syringes as we are distributing. So we can safely say that we are getting contaminated sharps out of the community. CEDAR also gave me a note saying that over 10,000 condoms were distributed over 2019, and probably many, many more than that, because those are a lot harder to count up. Next slide, please. So this is just an image of what syringe services looks like in the community. So these are all from CEDAR's and the tribe's outreach events. And one thing I wanted to point out on the top right-hand corner in that photo on the top is you can see there 3 containers. They're reddish containers, say free sharp containers there. So that gives you a visual of some of those sharps containers that are being distributed. We have gallon size. CEDAR, you might have to correct me. I'm not quite sure. I think we have quart and pint. And so those are free. We distribute, well, CEDAR distribute, I should be very clear. CEDAR's doing this, is distributing them out to people themselves to have, but then also organizations so that people can access them through different providers or through different places where they have services. CEDAR, was there anything else you wanted to add in about what's visible in these photos?
I think you did a pretty good job. I could describe some of the items on there. We do some awareness activities around safe disposal of prescription drugs. And you can see there's little bottles that look like prescription things. They have a timer on them. And we offer those for free. It's something that Jennifer Verstig-Beckner worked on with some of her work through overdose prevention. And I also passed some like swag around Overdose Awareness Day, which is actually this last month has been kind of an overdose awareness and recovery month informational exchange. There's also, let's see, first aid kits and yeah, I see there's a lot of stuff on there, isn't there? There's a lot of informational things. So if somebody needs OHP or they need STI testing, I get them connected to a provider. Or say, like Amy was talking about food resources, there's also a number of organizations in the community that do hot meals or some sort of distribution of resources and try to get people connected to them. And doing that in a trauma-informed way. So places that are not just open for business to distribute resources, but that are going to provide a safe and non-judgmental atmosphere for folks to get those services. That's so important when we're talking about systems violence on some of our community members, making sure they have positive experiences when they try to access services, because they'll be more to show up in the future.
Okay. And then if we could go to the next slide, please. So this is a photo of what's new for 2020. We have gotten a harm reduction outreach van. So basically it's, in a sense, a mobile clinic. At least it's a mobile clinic chair and table. And then because Cedar already has her testing and everything that's already mobile, let's have basically a space where a client can get out of the weather and do testing and have a more private conversation than one just on the side of the road. Which is very good. And then go to the next slide. So for 2021, we have a new project that we're pretty excited about. We are very, very close to having the formal announcement. But so far, we feel pretty confident that we're getting funding. We've applied for funding from the Delivery System Transformation Committee through the Intercommunity Health Network Coordinated Care Organization for our region to do a harm reduction plus hepatitis C treatment in primary care. We were 3rd out of 17 ranked for return of investment because we have a pretty low cost initiative that will have a really high healthcare cost savings impact in that we are delivering a brand new service to Lincoln County, being able to deliver hepatitis C treatment through our primary care clinics. And this will be delivered in 8 different clinics across Lincoln County. It'll be all of our federally qualified health center clinics, our school-based health center, and our veteran services. It'll be also delivered through the Siletz Community Health Clinic. We're partnering closely with them to make sure we have mirror projects. So we won't have the same program because theirs will be tailored to their needs and their system. But we will also have it connected with Samaritan infectious disease, and we're basically implementing 2 evidence-based interventions through one intervention. And we'll be having electronic consult with a Samaritan infectious disease specialist so that we can ensure our residents in Lincoln County are getting the highest quality of care for a primary care price. And so they're getting some specialist consult. We have support from Samaritan infectious disease to do this. And it's really going to be a pretty innovative systems change that we have, which is a really good example of what a modern public health systems change looks like. So I'm pretty excited about that, and you'll be hearing a lot more about it soon. We should find out on October 1st that we've gotten funded, but feel pretty good about it right now. And then for the next slide, please. So for challenges, basically, we have a need for support and awareness from other organizations around Lincoln County and across the region. This is a really new program compared to all the other programs and services that we have, traditionally throughout healthcare. And so we just need as much support as possible to be able to get more awareness that we have harm reduction services and normalize harm reduction services and really get them embedded into our usual practices. We need more access to people where they are. This is a different type of service model in that we need to be out where people live or where people are recreating or where people are accessing services to integrate harm reduction into those services rather than expecting people to be able to come and find Cedar at a fixed location. Cedar experiences challenges with populations who have instabilities in that individuals may be homeless or be unstably housed. They may be displaced from where they're living for various reasons, or they may be transient in that they are stopping by Lincoln County for a couple of weeks or a couple months before heading off to a new location. We have a limited service environment, so for services that are needed like shelters and hygiene facilities, that can be a challenge in navigating someone and getting them to be in a stable enough position to be able to move to the next steps. They need to have that kind of stable access or reliable access to those services. We have some challenges with having gaps in our various systems, and so that's one of the reasons why we're working with more partners to get closer coordination and data sharing to be able to get a better idea of the size of our challenges and to coordinate across our systems. And then people experience stigma, judgment, discrimination, and they have past traumas that are very sensitive to those stigma, judgments, and discrimination that can be a barrier for them accessing services that they need. And then last, what county officials and agencies can do is to continue to support syringe services. We really appreciate that our Board of Commissioners helps to support our syringe service program. And that's really a key thing because our funding from the state has a lot of restrictions, and those restrictions are those things that keep us from being able to do syringe services. So the support from our Board of Commissioners for general funds to be able to offset the costs of the syringe services is really key. To continue to advocate for harm reduction, adopting and using non-judgmental language and supporting more services to be non-judgmental. Providing access to clients if we can get more organizations and more jurisdictions to invite us in to provide our services into their services and environments, that would be very helpful. And then coordinating services with our harm reduction program, having service providers refer clients to Cedar and our Select's harm reduction workers, and then also coming out with us to offer complementary services would be really helpful, or coordinating to say Cedar can go out and provide services in a certain area before another service goes out per se. If it's like code enforcement, having Cedar go along with that to provide harm reduction services in support of those missions together. And then next slide, please. And this is my last slide before references, but this is just our website link, our email address. If you email harmreduction@co.lincoln.or.us, it comes to all of our harm reduction team and some of our partners, like our overdose prevention coordinator is also on that email since we work closely together. And then on the right-hand side is all of us who work in harm reduction through health promotion. Isabel, I don't believe is with us right now. She's gonna help us with some other presentations we have today, but she's our new health education specialist who's coordinating our regional grant. And that is all I have. What kind of questions or comments do you have?
I feel like I'm going to need a little bit to digest it all, so there'll probably be some emails to come, but I guess one thing I would say, I think we lost Sheriff Landers. I don't see him in here anymore, but it sounds like the idea of coordinating better with law enforcement and potentially with code enforcement. Oh, there he is. He say his name and he comes back. I think that's probably something worth exploring, and so I would just ask that maybe you follow up directly with him as he's the supervisor of code enforcement, and perhaps there can be some coordination and efforts there.
We've actually been very fortunate to have had a meeting with Sergeant Etheridge, who is how we got connected to the Law Enforcement Council. So we've been really well received by the Sheriff's Office, and we're really appreciative of having that connection.
Great. Sounds like that's maybe already underway then. So no other questions from me at this time. Like I said, I feel like it's a lot to digest, so I'll probably be back. Just a big thanks to both of you for the work you're doing, and I'm really glad to hear the number of sharps that we're getting out of the community, you know, while it's saving someone's life and getting them into treatment, I think is the main reason for the program. For me, it's also about getting those sharps out of the community and out of our parks and out of our sidewalks and where people are not exposed to them. So I'm really glad to hear that that is working. So with that, Commissioner Hall, questions or comments?
Comment, please. You know, I had been an advocate for a needle exchange program for years, and frankly did not get a very positive reception from previous HHS leadership. But when we did receive the funding to support Cedar's position, I believe it was co-director Austin who first approached me with the idea that we pick up the, you know, and I believe the outside funding funds her position at 75%. As previously mentioned, though, that funding did not allow her to work on needle exchange programs. So Director Austin said, what if if we pick up the other 25% to make the position full-time and dedicate those hours to needle exchange? And I said, wonderful, present it to the M team to carry up to the budget committee and the BOC. And it was really a slam dunk. So I want to thank all of the HHS team and partners for this tremendous success, and my colleagues for supporting the funding to make it possible. Thanks.
Commissioner Hunt, questions or comments?
Well, I got I guess a couple of questions and a couple of comments. I'll start out by admitting I'm a numbers guy. So it's great that for each new or clean needle that we give out, we get 2 back. I guess my question is, why is that the ratio? I intuitively would think it'd be more along 1-to-1.
We just started doing our syringe exchange, so you can imagine that there's probably syringes in the environment or in homes or in living situations that just need to get. So I would imagine that over time it might get closer to 1-to-1, though I think there's a lot of used syringes in the environment right now that we're picking up.
And generally, like, we have so much poverty in our county, a lot of people can't afford to dispose of syringes appropriately, and our local waste management places, they charge for biohazard waste. So for folks that can't afford that charge, having a disposal that's free is really helpful, especially like veterans and people who are living with diabetes or have pets that take whatever sort of shots or insulin.
Cedar, that reminds me that I believe the county had a bit of a challenge in determining how to dispose of those needles, but we were able to work out a very beneficial agreement with the Samaritan Health. Correct me if I'm wrong, but they're now working with us and offering that service at, frankly, a very reasonable price. So that would confirm your comment. I guess I'll ask you, Cedar, how talk about the challenge as far as acceptance. You know, their presentation talked about the stigma. What has your experience been as far as acceptance, and what's worked?
Mostly I have had a lot of acceptance, and people in our community have said it's about time. There have been a few people, I'd say it's the minority, that have mixed feelings about that, and typically it's from folks that don't really know very much about it. And then as far as stigma, for people that are affected by stigma, the more awareness, like these presentations that we have around what the services are, and more of an understanding at higher levels of how we can reduce some of those stigmas and barriers that folks experience. I think that will be really helpful for people that are affected by that.
Yeah, Educate, excuse me, education and creating awareness is big factors.
Yeah.
So the last comment, well, I've got a couple more things, sorry. I think it's important to note where this presentation talked about getting out in the community. That was not always the practice. And I think, again, it's worth noting that one of the changes and improvements that I believe we're seeing recently is the fact that you know, we've hired an individual like Cedar, and Cedar is charged with getting out in the community. And I'll thank Amy or whoever did the presentation. I've always had a hard time articulating that, but I think access to people where they are speaks to it very directly. And that's certainly a big change in how the county has tried to address these needs and deliver those services. So again, I think it's a significant improvement in the way we're doing business. So the last thing is, Cedar, you put a couple of things in the chat box, and I think both of them are noteworthy. So you said, can they change the name for trauma support? What's your suggestion there or your thought?
I'm not sure what that would be, but the resource situation up in Lincoln City, I guess there's a sign that says trauma support for our behavioral health staff. And a lot of folks don't really know what trauma is, that they're experiencing it. So my suggestion was just maybe we should ask for a different naming of that resource. And then somebody was mentioning some of the, maybe it was Claire Hall, Commissioner Hall, I think you might have said some resources that were available in Lincoln City. And I wanted to mention, I was up in Lincoln City recently and saw that at the La Roca restaurant, they had a sign on the door also that offered all sorts of items to people who were affected by the wildfires. So,
Well, I see that Director McBee Wilson is still, I believe, on the meeting, and I think we'll ask her, or maybe you can work with her to address that trauma support question. I think it's certainly a good one. So with that, keep up the good work. And again, I just marvel at the fact that we're getting out where people are.
thank you so much for your support. We appreciate it.
Yeah, and I guess one last thing I would say is, and I've told you this in person before, Cedar, but as you do find, you know, naysayers in the community, you know, here and there, I think dealing with some of that is where Commissioner Hunt and Hall and myself come in and responding to some of that. So if you do get people that aren't supportive or don't understand or whatever, feel free to pass them on to us for us to have that conversation. I think all of us are happy to do that. So
thank you.
Yeah. All right. Well, thanks for being here. It was a long meeting, so thanks for sticking in with us today. Christy, I think we're done. Can you take us back to our agenda?
Commissioner reports would be the only thing left, Chair Jacobson.
Yeah, I think so, but my memory is waning here, so I'll make sure. Commissioner reports, I'm going to go ahead.
I'm sorry, waning, is that a pun on our legal counsel's name?
It was not, but it should be. Under Commissioner reports, I'm going to pass no report to give at this time. Commissioner Hall, any reports?
I'll pass as well. Thank you.
Okay, Commissioner Hunt?
No, I have nothing, but I don't think we can say thank you to everyone enough. So thank you to everyone that's really been a part of dealing with two disasters, if you will, the virus and the wildfires.
And we're just going to see. There we go. I think that's it, but I just want to check before we adjourn to make sure I'm not missing anything. Yep, there we are. We did it all. Okay. With that, I will go ahead and adjourn our meeting, and our next Board of Commissioners meeting will be Monday, September 28th, 2020 at 3 p.m. again remotely, and then we have a joint remote work session with the City of Toledo on Wednesday, September 30th, 2020 at 5:30 p.m. All right, thanks everybody. Meeting is adjourned.